Hi, and welcome to today's video. I'm Mary Felling, physical therapist. I specialize in an area called the John Barnes Myofascial Release, and I've been practicing that for the last 25 years. Today I'm going to be showing you a technique that helps relieve low back pain. This is to get into a deep area of the hip that often impacts the low back, but is overlooked in most traditional therapy. All right, so you're going to be lying down on your back. You can do this on a couch or a bed. It won't change the effectiveness, but you can see I'm on a yoga mat on the floor, which is where I usually do my own self-treatments. And you're going to cross one leg over the other. The leg that's crossed is the side you're treating. So we're treating very deep in the hip here in an area called the piriformis, way deep. It's even below the glute muscles. So once you've got your leg over, so you've got your ankle right above your knee, bring your leg up towards you. Notice I'm going to relax this leg in. I'm not doing that. It's nice and relaxed. I've got my fingers dovetailed like this under my thigh. And I'm just bringing my leg up. And as I pull this left leg up towards my chest, get a nice pull back here. And that's what you're looking for. I do want to show you one modification though. If you're in this position and it's just a little too hard for you to stay there, put your foot up on a piece of furniture. Now, I've got a chair here. I'm just going to show you. So if you have a chair nearby or a couch, put your foot up and cross your leg over, and then you don't have to do the work. And the closer you get the chair, the further it'll push your leg back towards your chest to get the stretch here. If this pulls in your back, bring your leg out a little more. We only want to right now affect that piriformis. We don't want to strain or pull into the back. And by the way, if you're doing this and you feel it in your back, that's your body's way of saying this piriformis is involved in your back pain. Now, we've got the timer going, and I want you to hold the position, stay in this position, make sure you're nice and soft, your shoulders are back, you're breathing easy. You've got your arms down here, your arms aren't up there, everything is nice and relaxed. You can also, if this position isn't working for you, if you're in here and you're saying, I don't feel a thing down here, I don't feel anything in my back, you can cross this leg further over so that the back of your thigh is on top of the other leg, and you can bring your arms around and just hold yourself here, kind of like you're hugging your legs. I'm not really pulling much like this because I already feel this back here down in my piriformis. So if I wanted to, I could come up, and I feel quite a good stretch in that position. But I'm going to back off and go back to where we were in this figure 4 position. And we're going to be here 5 minutes. Now, why are we here 5 minutes? Well, this is a myofascial release technique. And what we want to do is help the fascia in this area. So the myofascial components, myo means muscle, fascia is that cobweb I always talk about in our body, runs from the top of the head down to the bottom of the feet, side to side and front and back. And that cobweb surrounds and infuses everything in our body, including the muscles, tendons, ligaments, your organs, your spinal cord, everything has that cobweb around it. Well, when it's injured from years of overuse, repetitive use, stress, surgeries or traumas, falling off a bike or skating around and you fall on your rear end. That's a very common one for kids when they're 10 and 11. But that follows us through life. So we're using a 5-minute mechanical energy. In this case, we're using a stretch. And the mechanical energy of stretch or compression, when it's put into the human body for 5 minutes, starts this phenomena called the piezoelectric effect. It's just a fancy word. It represents the bioelectric flow. And this bioelectric flow starts moving along fascia. It's kind of like the fascia's copper wire in your system. And when it comes to these areas where the fascia has been glued down and dehydrated because of the overuse or repetitive use through your life or injuries, it causes that to rehydrate, soften, and elongate. And when that happens, flexibility returns, pain goes away, your alignment improves, all kinds of good things. People sleep better. So it's this time, and the time factor is what's different with myofascial release than other elongating or what we'd call a stretch position. Now, I'm not working really hard here. I'm not a gladiator just muscling this leg of mine up to my chest. I've just pulled it up enough to where I feel this, and I feel it here, so I don't have to pull through the pain. You just go to the point. You've taken all the slack out of that hip and the glute area. We're working on the piriformis, and you hold it there. And what we're feeling for, what we're looking for, are called releases. When the fascia releases, you feel softening, there's less pain. Sometimes you have kind of a sensation of well-being. A memory might come up. That's always fun. And that's just the body releasing what it's been holding on to for however long it's been holding on to it. These could be things that have been there since childhood. That would not be unusual. When you're doing these techniques, you're always welcome to come back and follow these YouTube videos. I generally will stop at 5 minutes because that's the minimum time. That's what it takes to start that electrical flow. I encourage you, though, to continue to 7 minutes, 8 minutes, so that you can continue getting the effect of the piezoelectric effect, releasing and softening the fascia through the area you're working on. And then when you're done, come up slowly, walk around and see if you feel different. What changes? We're doing this specific technique. Not only does it help the hip, but this is really good for solving, resolving low back strain, low back pain, tension patterns that may have formed because you have to be in front of a screen all day, so you're sitting. Allow yourself time to do this. Put on some beautiful music. Close your eyes. I've got a pillow because it's nice and soft for me. I like that. I don't like to have my head all the way back down when I'm working on my lower body. Thank you for joining me in today's video. I look forward to seeing you again in the future videos. And until then, be well.